Hello, I'm Dr. Hilary Jones, a GP and TV presenter. Did you know that falls or stumbles is the most common cause of people being admitted to hospital when they're over 65? Yes, the most common cause. 1 in 3 people, in fact, who are over 65 will have a fall or a stumble, and about half of those will fall a lot more frequently than just once a year for various reasons. Now, fortunately, most falls don't result in serious injury, but some do, particularly fractures of the wrist, fractures of the ribs or the spine, or hip fractures, and these can have serious long-term implications, so you want to avoid them as much as possible. And there are ways of avoiding these things. I mean, for example, making sure you have non-slip mats in the bathroom, that you mop up any spills of water. You can make sure that you've got good lighting in the house, that you remove as much clutter as possible. You get help with lifting awkward or heavy things, and make sure that all mats and rugs are secure. These things sound pretty obvious, but actually they're quite important to do, and a lot of people will avoid falls if they can just eradicate those risks from around the house. And you can have a home hazard assessment organised by your GP or another healthcare professional if you think it would be worthwhile. But suppose you have a fall, what's going to happen then? And people might worry about you if you're vulnerable. Well, think about embracing technology. Let me show you something. This is a full sensor worn around the wrist at all times. And even if you go out of the house several hundred meters, this will send a signal if you fall to a base unit that will alert a care team that you might need emergency services. If you don't need those services, you simply cover the sensor, raise your arm with the sensor on the wrist, and that will cancel the call. But you've got peace of mind that someone's there to come and help should you be unlucky enough to have a fall. And as we all get older, that risk increases. Taking precautions, using technology really helps.